Hello, welcome to the training module for the Flying Dr. Telehealth Patient Question Form. This module will provide information about health literacy and take you through how to use the patient question form during telehealth appointments. What is health literacy and why does it matter? Health literacy is the cognitive and social skills which determine people's ability to access, use, and understand health information. It's more than just reading brochures or having appointments. It's how a patient navigates the health system, from signs and directions to language used and reading ability. Lower health literacy is associated with poorer health outcomes. Patients have higher mortality, hospitalisation and medication issues. Research also shows that 60% of Australians have inadequate health literacy. Flying Dr. Telehealth is supporting the need to apply a universal approach to being health literacy responsive. Health systems can place significant burden on patients to understand their healthcare needs and information. Patients can find it hard to understand consent, medical decision-making, medication doses, chronic disease management, advocating for themselves, and navigating health services. Effective communication in healthcare remains a challenge. Studies show that about 50 to 80% of clients don't understand or remember what they have been told by a healthcare provider. Communication, both verbal and written, is the second biggest factor contributing to clinical incidents. As healthcare professionals, we provide the majority of health information to our clients, and the way in which we communicate this information can have a strong influence on how people look after their health, and ultimately can affect their health outcomes. Health outcomes such as anxiety, depression, medication management, functional status, or diabetes complications. Clients must be able to understand, remember, and act on that information. There seems to be a communication gap between providers and their patients. In one study, 77% of healthcare providers thought that they had explained the patient's diagnosis clearly, but only 57% of those patients reported that they actually understood. Also, 90% of patients said that they were not told about the medication's side effects, but 81% of doctors said that they had explained. So how can we prevent this from happening? One way to address this is to assist patients to feel more confident asking questions. The Flying Dr. Telehealth team have developed a health literacy resource to help patients to get the most out of every telehealth appointment. We want to ensure patients feel confident and empowered to ask questions during their specialist appointments, and have developed a focus sheet of questions for patients to use before and during telehealth appointments. Clinics are sent a supply of telehealth sheets as notepads for their patients. Please give the question sheet to patients at least 1 week before their appointment to allow them time to prepare questions. They will also receive the question sheet along with their upcoming appointment information in the mail. Please help patients advocate for the time to ask questions during their telehealth appointments. For example, during the appointment you can suggest, do you want to go through the questions you've prepared? Evidence shows that this type of tool is likely to improve comfort and facilitate communication, increase the number of questions that are asked, and address lack of understanding, particularly with patients of low health literacy. This is the resource. The front, the image on the left, includes an area for patients to write prepared questions and the Ask Me 3 area for patients to write notes about the specialist's responses. The Ask Me 3 questions are: number 1, what is my main problem? Number 2, what do I need to do? And number 3, why is it important to me to do this? The image on the left is the back page. There's ample room for you or the patient to write more notes or information about medication. We're expecting the patients will ask this at the consultation, but you may need to prompt them. The Ask Me 3 questions would happen generally more at the end of the consultation, as an opportunity to highlight patients' health priorities and what they need to do after the appointment. Research is being undertaken to measure the impact of this tool on patients' ability to prepare and ask questions during appointments, with ethics approved through Monash University. While all Flying Dr. Telehealth patients will be sent and encouraged to use the telehealth question sheet, the research will only formally evaluate endocrinology patients. Therefore, only some patients will be contacted by the Flying Doctors to participate in an interview. We will also be inviting appointment facilitators to participate in the research through a future survey. The first steps of this project include rolling the resource out to all sites, and from there we will start data collection. So what do you as an appointment facilitator have to do? We don't expect this to add extra time to your work or the appointments, but it will be embedded into the program. We appreciate your support providing the resource to patients and prompting them to use the question sheet during appointments. If you have any questions about the resource or the research that's underway, please contact the Flying Doctor Telehealth team. Thank you.